We're almost there. Excited for what we'll learn tonight. Nice. Oh. So welcome, everyone. Good evening. Welcome to the last Monday of April 2024. Glory be to God that He has kept us safe. I'm Dr. Toyin Okpesomi, a family practitioner, HIV specialist, and I treat substance use disorder in Maryland. I'm always excited to be on this forum on Monday nights. And tonight, we have our very own Dr. Joseph Olowe, who will be telling us about wellness. He has amazing skills, amazing tools that I cannot wait to really learn and tap into tonight. So, fasten your seatbelts and let's start. We're going to learn more, much more than wellness, because I was given a tip of what we will learn. So, Dr. Lowe, the floor is yours. And welcome to Medical Mondays with Dr. O.
Thank you so much. Good evening, everybody. Thanks for coming. I've heard about Medical Monday, and I'm glad to finally be part of it. I was on last week listening, and I'm grateful for the opportunity, Dr. O. I'm Dr. Joseph Olowe. I doctor of physical therapies, over 30 years in practice. I have my master's in earth sciences and MBA, and I'm looking forward to starting another master's very shortly in sustainability. So tonight, I'm so privileged to have this platform to talk to you about wellness. And I'm sure a lot of people will say, what is wellness? What else are we going to learn? But I'm going to come at an angle that I believe will spring. So I'm going to share my screen, and I'm going to be sharing. Sorry, I'm going to share my screen, and I'm going to be coming from entire screen. Can we see my screen?
Yes.
Fantastic. All right. All right. Okay. So, Dr. Joseph Olowe, we're driving preventive healthcare in Africa, in Nigeria. We've been in Nigeria working for the last 3 years, and we've been able to discover amazing things. I'm going to share a little bit of the journey of our awareness journey in Nigeria. Then I will share some of the report the sample report of our work. And I put a link on the chat box. That link, if you copy the link or open the link, it will show you a little bit more about Dr. Connect and about what we do. So let me give you a little bit of introduction about what drove me to this. Our healthcare system is broken in Nigeria. I'm telling you, in Nigeria, everywhere in the US, the system is even worse. I am based in Texas right now. I practice out of Texas, but this year I closed my practice just to focus on wellness to make sure that we can get people back in shape. Let me tell you the story of my friend Jim. Jim passed away at age 42. Jim had an autoimmune disease that affected his pancreas, destroyed his pancreas, had a type 1 diabetes. Jim was fairly healthy, doing everything right, but never checked anything. What brought everything to light was Jim stepped on a nail or something in his office, busted his leg, and the wound will not heal. And one thing led to the other, heart sepsis, they had to amputate Jim's leg. Jim went into severe depression. Eventually, Jim committed suicide. That is the story of 1 in 4 Nigerian or 1 in 4 American. The problem we are having is we have a reactive and a disconnected process. We wait until we feel sick, and then we go talk to a doctor. By the time we talk to a doctor, we get medication. Once we get medication, we recover and we're okay. But sometimes the story does not always end like that. By the time we figure out that little problem is stage 4 breast cancer, and it's too late with metastasis. So because of this problem, 50% of Nigerians are sick, 25 million people with CKD, 1 in 30 Nigerians that have stroke, with 40% of them will die within 30 days. WHO projects within 10 years, 5 million Nigerians will die from a chronic disease. And this same statistics is the same for Africa, is the same for America, and all over the world. So we need to shift our focus from sick care model to a preventive care model. The statistics is not smiling at all. These 3 guys that you are seeing, we came together because we're all friends of Jim, and we said there will be no more. I am physical therapist for 30 years. Wale is 10 years in marketing and branding, and Jide is 20 years in software development. We came together and we developed a solution that we felt that would move the narrative forward in wellness. What did we do? We created a one-stop solution platform that you can do your testing, you can do your treatment, and you can do your tracking. I'm sure a lot of us know about remote patient monitoring, but the problem is that we get the testing somewhere, we get the treatment somewhere, and we get the remote patient monitoring somewhere. So we have so much silo in data, in care, everything is fragmented. So we solve for that on this platform. What is the product? This is the product. We curated a test, over 80 tests, batch of 80 tests, like the test that you will get in Mayo Clinic or Cleveland Clinic, except for the fact that we brought the price down. And then we talk in that 80 tests, we track 250 biomarkers, and that we layer that with the mental health. So why do we do that? Because that will tell us exactly what is going on in your body at this time. Now, the mental health, the reason why we're so insistent about doing mental health screening or evaluation is because we don't even know when the mental issue began with Jim. Maybe Jim already had a mental issue before the incident, or maybe the incident triggered it. We don't know, but we just knew that he went to depression because after the amputation. So how do I look at the future? How do I see what is going on? Then we decided to do DNA genomics analysis, and that will give us a bunch of information and give us an opportunity to be able to predict, to be able to prevent, and to be able to treat your information. When we put all this information into the software, we're able to come up with a lot of prediction. And now, on the same platform, we're able to treat you. We have doctors, we have mental health therapists, we have nutritionists, we have health coaches on the same platform. So you're not jumping from one platform to another platform to have your treatment. At the same time, we have connective devices that you can use, your Apple Watch, your Garmin, your Fitbit, and for us to collect data back so that we can help you get better. Now, we have our own devices that we made, and if you look at the link that I set on that platform, you'll be able to see how one device is enough for a family. A family of 5 in the US, you can buy one of our devices, or you can buy our devices, and everybody in the family can share the device. So, and we use AI for medication management, diets, and nutrition and exercise recommendation. So that is the first part of my assessment, my presentation. What does our wellness result look like? What we charge $100 for in Nigeria, and what I believe in the US, once we launch later this year, early 2025, we will be charging about $900 for this. My computer is a little slow. Okay, this is slow. We can go right here. Now, this is the result. This is what our wellness looks like. Once you come into our facilities, we do what is called a double hand high blood pressure. We put your hand in the same, we take your blood pressure on both hands at the same time. And what we're looking for an interhand differential. If the pressure is more than 10 millimeter mercury, then that gives us an indication of some cardiac problem. And it's an AI machine, and it will automatically stage your hypertension as pre-hypertension, hypertensive, or stage 2 and whatever. Because of COVID, we now do temperature, we do blood oxygen, just to make sure that since COVID has been in town, that has become a very powerful vital sign to track. Then we go into cardiovascular. We do a full 12-lead ECG that will give us a quick comment by AI, can give us sinus tachycardia, an impression, remote anteroceptor infarction. Then we have a cardiology review on the system. Why is everything freezing? So then we go ahead, we do your vision screening, and we look at that. If we need to refer, we refer. And this criteria for referral is right here, right or left side, mild impairment or moderate impairment. Then we go ahead and do your hearing screening. The hearing screening is done at so many decibels, at so many frequency, 3. You either pass or fail, and then we can make a referral. Then we go into cardiovascular scanning. We do a carotid ultrasound scan on the right side to check for atherosclerosis and to measure the diameter to make sure that it's okay. We measure the right and we measure the left carotid ultrasound, and then we go into the abdominal ultrasound. We do the full abdominal ultrasound just to check to make sure that there's no aneurysm or kink or anything, and we measure the diameter. And we have that. Then we do what is called a full body composition analysis, where we're able to look at your muscle fat analysis, obesity analysis, abdominal obesity analysis, and then we get a control guide. And then we move into the blood work. We do a full, complete metabolic profile, checking kidney function. We look at liver function. We look at full blood count. We look at blood sugar, A1C. Then we go into uric acid. We look at uric acid, check kidney function. We do a full lipid profile. We do urinalysis, and then we do what is called a musculoskeletal scan. We go in and do a full musculoskeletal scan just to find out how your body is aging, if you're going to have arthritis and all that. If you look at this result, you can look at the arch difference. One of the problems we have in the US, all over the world, is somebody comes in and said, I need surgery, I'm having knee pain. The surgeon goes in and does a fantabulous job. And the patient said, I'm fine, I'm walking okay, I'm doing good. But with this arch difference, we have not resolved the problem of the patient. The patient goes away for 6 months, and after 6 months, the patient will start having problems because the arch, there's 75% right arch collapse. If that is not taken care of, that surgery is gonna relapse again. Then we get a full doctor's recommendation, and that is one of the things that's what our wellness report looks like. Then my final presentation will be this is our DNA. So what does our DNA review look like? I hope this can just give me some good look right here. If not, I don't know why my thing is one second. Okay. Can we see my screen?
Yes.
All right. So this is it's not what I want. Okay. So why do we do DNA? We do DNA because this is my own report. I'm just going to hide it right there. But this is how it works. Our wellness report analyze how your DNA influence your health. So then we then use this analysis to give you a personalized risk estimate and recommendations. We use artificial intelligence and machine learning to analyze all this information. We then summarize your result as a risk score and display it in a gauge. Now, these are the things I want you to pay attention on. Because something is in your DNA does not mean that it's going to become a problem. But once we see anything that has a higher prevalence of happening, then we go ahead and bring that into a physical testing. So if we have a tendency that we see that there might be a lung problem, then we start screening you for a lung issue right from when we get the DNA result. The beauty about our DNA analysis is that we have over 850 reports on every part of the body you can think about, your skin, your hair. We can get data and we can use those data to drive your health, to design personalized care for you, and to be able to guide you, make sure that you are never sick. So what drives us in our company is three shun. Number one is nutrition. We make sure that if you eat right, you're not going to be sick. Number two is prevention. If you cannot eat right, which most of us cannot do that, we can't eat right. And that's the problem. Is that because we don't have the money or we don't have the time? We go into prevention. When you check yourself frequently, you can track the problem. And the third one is intervention. We don't want people to get into intervention, but most people will get there. And that's why we need most people on this platform to do it. But we pray that there will be no amputation, there will be no problem, there will be no slumming. So this is the end of my presentation briefly. And I'm going to ask one question from us. If any on this platform know somebody in the last 365 days that have passed away because of they slump, they didn't wake up from sleep, just give me a thumbs up on your Google, on your Zoom.
Can you pull the screen down so that you'll be able to view the response?
Yes, let me just stop sharing. So if you have somebody in the last 365 days that have slumped, or you know of a friend, please just go ahead and give us a thumbs up. So that's the basic thing that we do in our organization in Nigeria. Here we are launching here. We've been fortunate to be invited to Qatar to launch, and we're gonna be launching in Egypt as well. This thing. So there's a question. Then
I will get to the questions.
Yes,
Done,
before I finish my presentation, so we have on this platform, we take it one step further. So we've been able to curate an insurance for our people in Nigeria. We have 3 plans or four plans that we curated. And I have my partners on the platform. We can quickly go over the insurance. We have if you want to see the package, we will demonstrate the package for you. We have insurance that you can buy for your family at home that will cover some of these tests. We have one for $25 per annum. We have one for $35 per annum. We have one for $55 per annum. And then if you have a family back home that needs some of that you want to give a gift of health insurance, we can provide that vehicle for you. And now we have created an international plan for people in diaspora. If you are in diaspora and you are traveling to Nigeria and you want to be covered and you want to get some of this full wellness evaluation and DNA analysis done, we have an opportunity to do that for you in Nigeria. I will use the floor to Dr. Ho, and if you want us to display the plans, we have them here for it to be displayed, and we'll be glad to take questions. Dr. O, thanks for the opportunity to present. I hope I've not wasted people's time.
Thank you very much. No, you haven't. Thank you for showing us the state-of-the-art, one-stop shop screening tool. Dr. Kazim Mustafa had his hand raised. Can you kindly please unmute and ask your question? He had his hand raised before you continued. Thank you.
I think Dr. Mustafa is one of our team in Nigeria.
He had his hand raised.
Yes.
So maybe he has a question or an input. I don't know. So
I think I think we can move on. Good evening. Sorry, it's evening here. It's in fact past 12 a.m. in Nigeria. So please let's carry on. I reserve my comment until we are done with every presentation.
thank you very much. Dr. Aluya, you have the floor, please. Kindly unmute. That's
Yes.
like national.
Yes. Hi. Thank you. Great work. It's good to see that there are people who are taking charge and leadership of this particular space and providing care and services in this format. This is very futuristic. It's truly idealistic, and it's what we hope to see and what we hope to get. As a matter of fact, I'm still in the office, and some of all those things you just talked about, we still don't do here that much, even as we are right now in the United States. I've worked in teaching hospitals, different areas where I've worked, and some of these things are still far-fetched, especially in applying AI and everything else in this regard. A couple of years ago, I was involved in some project like this, where we traversed the whole of America talking about, telehealth, before telehealth. This was way before COVID and all that. But one of the things, a few things I would draw our attention to, two things. One, the data that you're collecting and the DNA analysis that you're doing, these are compared to what is in the database. And the irony with what it is, knowing what healthcare is here in the United States and in Nigeria, we know that every research that you have, the maximum percentage of Black people in that research is 2%, period, anywhere. And if you're comparing these things to individuals, especially in Nigeria or Blacks, I don't know where you get your data from. Maybe you're going to tell us. Who are you comparing this with? Because one of the things that we'll truly begin to understand and know now is we're different. Our genetics is different and everything is different. And some of us here have talked about epigenetics before. What is epigenetics? Epigenetics is how your environment, where you live, the food you eat, the factors in water, everything, the altitude, how it affects the way your DNA is expressed. It doesn't change the DNA itself. It's just the expression of it. Meaning, if you live in certain areas, because you live there, you may be bound to have multiple myeloma or multiple sclerosis, or you have diabetes because you live in that area. And that's how it is. So doing what you're doing, I don't know if you factored in epigenetics in this as well. And what are the data that you're comparing these Nigerians back home, any Black person around, with the database you're getting? Now, the second question is this. In medicine, we have what they call incidental finding. And our forefathers here you often say, if it ain't broke, don't fix it. Why are they saying that? Don't go looking for stuff that you can't handle, because if you find it, then the question is, what are you going to do with it? You pick up, and you said over 80 genetics or things that are going to come up. The problem with that is you're going to pick up a whole lot of things that might result in anxiety, agitation in individuals, because what people don't want to hear is, oh, you have a high propensity of having cancer. You did say so. It doesn't mean you have, but just saying that you have a high propensity of having cancer, it's a big trigger for anybody. And that will cause a whole lot of anxiety. In the United States, for one time, they actually discourage people from doing PSA. Dr. O knows that. Most people don't do PSA anymore. Why?
No,
because
now is the standard not to.
Right. So not to do it, the screening, because there was a whole lot of biopsies that were being done that were resulting in things that was normal. However, the caveat to that, and I teach this in medical school, is that you look at the individuals. That statement is broad-based, but because we know that in those of us who have African descent, we have a higher incidence of prostate cancer than not, and the family history, you have to look at those things so that when you screen based on the risk factor, which is family history, everything else, where you come from, all that put together. So the analogy of trying to say is this: when you run that gamut of tests, you are bound to pick up something that may not necessarily be in the family, maybe the environment has changed it, and it may result in a lot of anxiety and agitation. So have you considered that, and how are you going to mitigate those issues when they come up? Thank you.
Thank you, Dr. Olowe. Thank you so much. Let me start from the question of the DNA. The DNA, believe it or not, we don't have a lot of samples in Africa, but we do have ample, good enough of samples that we can benchmark this data with. Number two, one of the reasons why our services is extremely cheap is because we're driving innovation and we're driving adoption so that we can have this genetic data that can help us do a lot of research and help us solve a lot of problems that we might have in the future. So yeah, we are still early on, but that does not stop us from collecting and getting this data and making it very affordable for people in Nigeria to be able to continue to do this kind of testing. So I hope that answered that question. Number two, you were talking about incident two. Yeah, believe me, a lot of I usually do my testing in Nigeria in my office, but when I come to the US, I still go because I believe I still go to my doctor to say hi, I'm back. I want you to check me, do a physical examination for my, because you cannot heal yourself. But let me tell you one thing, it's good to know, but it's dangerous not to know. So, and that's one of the problems we have in Africa. And we take this statement that you made right now, people take it so far. I'm a pastor, born again Christian, but one of the major problems, my biggest competition in Nigeria is the blood of Jesus. And it's okay. We believe in that blood. The blood is powerful, it can heal. But we've seen pastors just drop dead from the pulpit. We've seen pastors that did not wake up. So we are heavily educating our people. It's good, it's okay if I cause a little anxiety and then we're able to get that anxiety checked out and we realize that the anxiety is zero, compared for you not to know. So to answer that question, yes. Now, the way we handle our genomic data, number one, security is high. We are HIPAA compliant. We are on Microsoft Azure, and we do double factor, and we do data vaulting. Now, I said there are three colors on the DNA. So we always look for the one that has a red, a higher prevalence. And the way we tell people, I always tell people, the most powerful thing that a human being has is the blood. The blood speaks. The Bible says the blood speaks. So because you have cancer in your DNA does not mean, if your blood does not tell us you have cancer, it can rot in that DNA. But once we get that information, I can sit down with the patient and say, hey, we see a higher prevalence of this. This might be a 5-year, this might be a 10-year. But why don't we start testing for this particular problem every year so that if it ever materializes, we're able to catch it and able to nip it in the bud. And that is the sole purpose of this, moving from sick care model to a proactive and preventive wellness strategies. I hope I answered that question, Dr. Olowe.
Well, to a large extent, yes. I'll tell you this. I'm very pragmatic and we're very practical. The big issue in Nigeria is still not complex. Like I said, we live in the most complex and most highly technological atmosphere you can ever wait. I'm here in New Jersey. We're still not as complex. Neither is Nigeria as complex yet. But to say that to cause a little anxiety is okay, you can't measure anxiety. You really cannot. What you feel is little for you, maybe something else for somebody else.
We do mental health screening, and within our app we have tools that can help you manage your anxiety if you do have anxiety. Not only health concerns causes anxiety. Doc, people live with anxiety every day. Financial, news, a whole lot of things. So that will be my submission to you, Dr. Aluya.
I get you. I'm not trying to bust your bubble or anything. I'm just
I'm not concerned
right.
about that.
So, and I'll be very frank with you. Again, it's simple, making it simple. I commend what you're doing. And it's the future, no doubt. I know exactly what it is, and all that. I speak about this and all the 5 technologies that will change how you and I will interact with each other and how we interact with our environment. However, the anxiety that you talked about, there's nothing like an anxiety cause when it comes to a medical issue. We've seen this, and I've dealt with a lot of people who have gone through that. And it has resulted in a lot of unnecessary surgeries, unnecessary tests, and a whole lot of other issues. I know that the number may not be, but just one enough is big enough. Now, you did mention something about data. In the data, they say, is the new currency. And whoever controls data controls everything. If what you're doing, which is great, incredible, because we don't have that data in our hands, especially when it comes to Africa and sub-Saharan Africa especially. Securing that data is one. We know that even the best of centers here in the United States, people hack into these things. They hack into it. And they collect that data. And you and I know that you in the future will be a big target. And people will want to collect that. So my advice is find a way of securing that data. If you have to code it in blockchain, then probably that's what you have to do. But then, kudos to you and congratulations.
Thank you, Doctor. We might need to talk and bring you on as a consultant. The data is very, very, very pertinent to us and very important to us. Thank goodness for the last 3 years, we've never been hacked, and we'll continue to do our best. Never say never. So, but we believe the good that we're doing in Africa, the data we're collecting, will help change the narrative of our healthcare system, and we'll be able to develop medications that will be able to help Black people, especially Nigerians, by the grace of God. Thank you, Dr. Aluya, for your contribution.
And I say amen to that. Thank you.
Thank you so much. And amen to that. Thank you, Dr. Aluya, for the thought-provoking questions. Actually, I am a little bit surprised about the presentation. I expected more tutelage on health, but the presentation is the presentation. We appreciate you, and this is cutting edge. It's not going to be only Nigeria. It's going to roll over to Africa and here overseas, because this is cutting edge. Like Dr. Aluya said, we don't even have this here yet. And when it comes to data, what you have is priceless, because our people, like Dr. Aluya said, I echo him, don't participate in research. Thank God, because there are lots of people our color now in medicine, the numbers are, increasing. We're encouraging people to participate in research, but we still have a long ways to go. So your data, Dr. Aluya, what he mentioned, your initial question, the data is really, African. It's Nigerian mainly, and, other, people, other Africans that will be there, that will be testing. So this data is going to become critical. And yes, they still, they're collecting now. It's been 3 years. And eventually, that's the data that, look, it's going to become, like I said, priceless, even to the Western world, that everybody will be looking for. And that is true that you have to protect it. working on protecting it from now, it's very important. But some people are, they're not right and may want to just act instead of, going the right way for it. So, Dr. Olowe, you trained here, so you know that we are trained that if we cannot intervene, we should not screen. And you are right on the money. It is good to know and dangerous not to know. We've been preaching that. That's why we do screening tests. That's why we check basic liver function, cholesterol function, blood sugar, the A1C, what the blood glucose has been running in the past 3 months, so that we can predict if somebody is at high risk for diabetes or not, and what they can do to reverse it. Then we'll be able to discuss it only because we have screened and we know. If we don't screen, we won't know. And we're able to revert some. We will listen. Instead of them tilting to diabetes, they can actually reverse that process. So screening is very important, which is what you do. What I would advise and would like to see is that with every screening test, that there is an intervention. There is something to do if it is positive, to confirm first that it is true, because yes, it is right, there will be false negatives, there will be reasons why this test is positive, but it's not really real. There has to be a confirmation, and if it is confirmed, then ways to intervene. That will be very important. But look, hands down, 100%, this is amazing. In fact, I want to test. And
Thank you so
I
much.
told you I'm going to test.
So when it comes to intervention, one of the things we did was we brought the providers together in one place. So one of the amazing things we do in Nigeria, if you do a full wellness test, it comes with a doctor's visit for the entire year. You can come and see a doctor as many times as possible. When you buy the $100 test, you get all the tests done, and you can talk to the doctor on the phone, telemedicine on the platform, unlimited for 1 year. And the reason why we did that, people say, "Are you sure you're going to make money?" We want to give people the opportunity. You must talk to a doctor. It's already paid for, it's already bundled in, and you are able to talk to a doctor when you need to talk to a doctor. And then we have the likes of mental health therapists on that. We have health coaches. If you've seen our app, we have a gym on that app. We have a remote patient monitoring tools. We have a pedometer. You can actually monitor your steps and link that to your weight loss. A ton of tools on the platform, and I encourage people to download the app. It's on iOS, on Play Store. Thank you.
Thank you. So, Dr. Mustafa, you have your hand raised again. You can ask your question.
Thank you very much. I think it's thank you. What I hope the meeting will still get to that. What we are trying to do with Dr. Olowe is to help people at the lower end of the spectrum, socioeconomically in Nigeria. So we are trying to drive the mass market. A lot of all these tests that we are talking about as physicians are still not available to most of the ordinary people. So, and that is why we feel giving them opportunity to also have access to all these tests will be a plus, and it will have a very good impact on the average health outlook of our people. Okay, concerning the full DNA genome, I think we have also listened to some of your concerns, and we'll sit down with Dr. Olowe as physicians to also echo those apprehensions that you have on the DNA genome. But colleagues, I just want to let you know that, yeah, we are fully here. And even to do ordinary PCR tests, DNA, whatever, is a big deal. How many centers where Lagos and Abuja are the two most complex cities in the country. How many of these centers do we have? Even for paternity assessment, samples are sent to the Western world. So that is why the innovation being brought by Dr. Olowe is not only for, I mean, it will really be a source of social interventions in terms of creating access for the people. But I can tell you, we are also quite concerned about the anxiety component. And we're going to discuss further with Dr. Olowe on that. But the mass market we are trying to create is after the exposure to all these tests, there's also insurance component. You can see the
can we
analysis.
add that to the question at heart first?
Okay.
Thank you so much.
That's my comment for now, because I can see the concern about, but we need to have a platform that can really give us the right data here. Data is everything, but it's one of the most important challenges we are having in the health system. Informatics about health system in Nigeria, we are very excited to be a part of this, because it will be a source of raw data that we have, that can pass the integrity with respect to Nigeria and Africa. So let me stop at that. But we are really very excited at, one, creating access for people. Most people just lump and dice, especially the poor people. So this is what is going to change. But all those concerns, I can assure you, we be considered very strongly. Thank you.
Well, let me make a comment quickly, Dr. O. So DNA is, how I say it now, is a choice. You can, we push the basic wellness, the wellness examination, we push that. And we have some other tests. We can do other tests. We can customize your own test. DNA is a layer that we put on it and is optional. If you want to do it, they're available. If you want to see the garment of your head, I've done it. My wife have done it. And to be honest with you, it's giving me more peace of mind to know what is in my DNA rather than more anxiety. But I know that, like Dr. Kaduya said, we take news, we're able to bear news better than each other. Dr. O, I yield the floor back to you.
Thank you very much. Before I call Dr. Izugu, your hand is raised. I would like to, stress that what we have always stressed on Medical Mondays is preventive medicine. It is important to, see your doctor once a year, do your routine tests, and if you have chronic illnesses, to take medications if you need it, or, follow instructions on how to resolve it if it's one that is resolvable. We have discussed a lot of different disease entities on here, on this platform, and you can always go to YouTube or Facebook, search for Medical Mondays with Dr. O to see the past episodes, to see anything that you may be dealing with that you may want answers to. So what this forum is really about is about preventive medicine, prevention, finding what is wrong before it really happens. But when it has happened, we also on this forum address it. So Dr. Izugu, kindly unmute and ask your question.
Yeah, thank you. Thank you very much. Dr. Olowe, thanks for the presentation. And it's like yours, like a ring singing in my ears. What I was hearing is really beautiful. You emphasize the importance of, first, prevention. You gave a good story as to what happened to your friend. I'm sure many of us in this forum have either had a friend or a family member where something happened in Nigeria and they say, I wish, basic tests, all that, and something happened. And also you emphasize prevention, trying to, get at it before people die. And also the challenges with churches and, it's not my portion, that kind of situation. We'll all deal with that. And then also emphasizing the importance of using today's technology to really help patients in remote areas, and regardless of where they are, we can help them. So all those are really beautiful. The issue with anxiety provoking, let's say with DNA or certain battery of tests is real. It's a big issue. And sometimes when people get that information and first of all, they have issue with interpretation, or even when they have a real interpretation and they have no place to go for further evaluation of what to do next, it can become a problem. You also mentioned that you have in your platform here, you have already physicians who will see the patient after the test, whether by telemedicine or whatever. It would be a good idea to consider where when a patient comes for those evaluations, they can be given the opportunity to talk to the physician first so that you can have clinically directed evaluation. Where the physician can see them, whether it's 10 minutes, telemedicine, whatever, and then recommend something and say, well, after you do these things, when you come out, we can discuss some further. So that at least you don't go, do a lot of battery of tests that can create an anxiety on an individual who may not know. I had a case just not even a few days ago from Nigeria, somebody who has been having some issue, and they did a battery of tests, and they did a carotid study, less than 50% falling here and there, and they told that person that that's the reason why they are passing out. And so he had to take an issue of getting a vascular person, discussing, coming to cardiology, to get other issues. And that's because the person have access to people who can help, make those kind of advice. So that would be my suggestion, is to go clinical directed testing. There are specific ones we usually get every year, and people, but that would be my advice. And thank you again for what you do.
Thank you, Dr. Ezugwu. I'm going to reiterate again, when you do this test, you have unlimited doctor visit. So not only 1 or 2 visits, we have cardiologists on the platform, nephrologists on the platform that we make referrals to. It's an end-to-end solution. So we don't just, you and I will be working more in Nigeria right now. Now we know that you are there. So we have cardiology. Even when we do our tests, we don't tell anybody our ECG reading is sent out for a cardiology review before we tell the patient that is even normal. Even when we see that it's normal, we make sure a cardiologist look at it, and they look at the waves and make sure that everything is in line. So again, one of my mission is I don't want you to take medication unless you talk to a provider. And that's why we have as little as 3,000 naira a year for telemedicine. If you just want to talk to a doctor, just pay 3,000 naira and talk to a doctor on telemedicine. But we believe that's why we work to make sure that this insurance platform is readily available. As low as $25. If you go to a buffet in America, you can blow $25. You can save somebody's life with $25 in Nigeria and buy an insurance, which we cover some of the tests, not all of the tests, and we give that person the peace of mind, hospital care, and all of that. And that's why we are doing a end-to-end. Not only are we doing prevention, we are looking at intervention. If you need hospitalization, if you need all of these things, this is what you can buy that can help you cure that problem, anxiety. So Dr. Ezugwu, thanks for your comment. I appreciate it. And we are given, and by the way, all these tests that we have, because of technology, we're able to do the test under 1 hour. All the tests that you see on that form. And then you can check our website. We're in the US. We're just not live yet. We are born here, and the technology that we are using is coming. It's a lot of people in the US that are interested. So it's a matter of time we'll be rolling out. But you can check www.drconnect.com in the US, /US. You will see our website, and you can see all of that tests that we do on the platform. Thank you. I yield the floor, Dr. O.
So if you can put that in the chat box, that would be great when you are able. I have a question in the chat box that says, where can you be met in Nigeria, and how do you charge in Naira? I'm going to answer that question. Sister Kendi or Brother Kendi, I don't know, he already put it on there. They are at plot 15 CIPM Avenue in Alausa, Ikeja. It's right below your text. So on this platform, we have talked about the heart disease prevention training center in Enugu and Oshodi that was spearheaded by Dr. Izugu. And we talked about the government insurance that covers people to see doctors in different areas in Nigeria, in different settings, including this HDPTC. That's the acronym for Heart Disease Prevention and Training Center. So they too accept the insurance. It's just like in the US or in the UK when you have an insurance and, you know, certain doctors would accept it, but some will not. So they accept it. So what Dr. Connect, Dr. Olowe, is talking about, just to make it clearer, is that they have an insurance, health insurance also, that people can buy and so have access to providers who work with them. And with that insurance also, they can do the testings that is showed based on level of testing that they may want. We've talked about it here. We have many family members, you know, outside the country who would call us that they're sick and without paying in Nigeria, for instance, you cannot get care. So then we start dishing out money. If they have insurance, that will not be the case. So we've been encouraging you on Medical Mondays with Dr. O that buy the government insurance for your family members that covers them so that they can go to, they can access health care when they need it, instead of having to, you know, now be spending exorbitant amount of money that we dish out. We've been saying that, but this is now an alternative, which is fantastic. It's always good to have alternatives. It's always good to have those rivals. I think it brings the cost of insurances and stuff like that down. So at this point, if you can spend 5 minutes to show the kinds of insurance, because this, you know, that is possible for people to get. And I know you're still networking to get different providers that will partner with you. But if you choose the insurance, that would be great.
Thank you. I would say this quickly. Dr. Mustafa, do we have the slides available, or do you want me to project? Dr. Mustafa.
Olaiwola is there. Olaiwola
can you project, Mr. Olaiwola? So we have three plans right now. We have a $25, a $35. We have the international plan for anybody that wants to go to Nigeria and do that. And by the way, we are all on EHR. Our EHR partner, they're on the call as well. If you join, if you want to know about your family member and they give you the clearance to get into their business, you can access their information, your father, your mother, your brother and sister that you are paying for, and they give you a written consent that you can know about them. You can actually log into the patient portal and figure out and see what we're doing for them on the clinic. Dr.
So EHR means electronic health record.
Very good.
Yeah.
Is Mr. Olaiwola there, or I want me to share the little I have here?
Okay, go ahead and share.
So my computer is just freezing up. I don't know why. So okay. So can everybody see my screen?
Yes, we can.
So we have this, we call it Anikulapo Healthcare Plan. And why do we call it Anikulapo? We call it Anikulapo because if you want to carry, what it means that you carry debt in your pocket. So if you want to carry debt in your pocket, then you need to take care of your health, and you need to make sure that your health is intact. So we have, I might not be able to go over everything because we have to show 2 or 3 plans. So this is the 25, it has a primary level care. You can see surgical procedure, internal medicine here and there, a little bit of everything, mental health, pediatrics, primary health care or obstetric, ophthalmology, emergency care, welfare, primary care, family planning, dental, so secondary care, a little bit of that. This and I wouldn't be able to go over the detail here, but this plan is $25. But the good thing about this insurance is not only you pay for the insurance, we have some benefit to that. In Nigeria, but I know $25 is not a big deal to us, but in Nigeria, if you have a family in Nigeria that you want them to pay, we can actually convert that to Naira and we can get them to our partner that they can pay buy now, pay later. We're partnering with Fela's family. That's why they allow us to use their name. We might be able to have some benefit for them, people that like to gyrate. In Nigeria, this insurance company will give you access to food bank services. What does that mean? People in Nigeria can buy food on credit, or if they need to buy food in bulk and they don't have the money, because they are part of this insurance, we partner with company that can make that available to them. They will be able to buy that food in bulk and they will be able to pay very little. Beautiful things about this program is that if they pay their bill through one of our partner, there's a credit that they get, just like you go to Sam's Club and you buy stuff and they give you some credit back. At the end of the day, you can use part of that credit to apply to your health insurance premium. Patient portal, you can see your health insurance. You can see your medical record from the insurance. We have online consultation. We have online gymnasium. You can track medication. You can, there's basic annual wellness. This access to bank that could defray your cost, is sweet. One of the things that we're able to partner with a bank in Nigeria. If you keep X amount of money on the balance, if you keep a minimum balance every month on your account for 6 months, they might be able to pay for your entire premium for those people in Nigeria. We display this here just for you to see that this is not only health insurance. We want to make it all inclusive. And then there's a disability and life insurance cover 50,000 naira. If you look at this, we're giving access to living life to the fullest. Not only will you get health insurance, you're able to get health insurance with all this benefit. And then the other plan is a $35 plan, almost the same thing, just a little bit more. Let me go to the international plan. The international plan is a plan that you can buy from here and use in Nigeria when you're there. We call it Anikulapo Health Insurance Plan. This is very heavy. I will take you down to what we have done there as benefit. I'm sure nobody will have the pregnancy. I will go to Nigeria to have a baby. That's not going to happen. But if you are there and this thing happened and that's an emergency, we can help you with that. This is the plan, the benefit at glance. So we have emerald, sapphire, emerald, ruby, gold, platinum, and diamond, and they have a lot of other things. The good thing about it, you can come to Nigeria, you'll be able to get the best of hospital. If anything happened to you, most importantly, you have the wellness, that we just talked about. You have it. Sorry, you have the wellness here that we just talked about. You have it covered here in all three plans that were. This one, they're still doing the actuary plan right now. I'll be able to get the plan to Dr. O, but we believe the plan will be between 500 naira, $100 for an entire year, up to $500 for some other things that have a lot of other benefits. And when you go to Nigeria, you have the peace of mind and you are rest assured that you're covered. I want you to understand that most insurance that we have here, they don't trust us enough for us to be able to use their insurance, Aetna, Blue Shield, Blue Cross in Nigeria. But with this, the company we are working with in Nigeria has been proven, it's been tested. They've been in the game since the beginning. They carry most of all the Nigerian universities. They carry a lot of people, a lot of ministry parastatal. So we did our homework before we partner with them. So this is our submission. Dr. O, I will yield the floor. If we have any question, we'll be able to kind of share some of these things once we finalize it. Thank you so much.
Thank you. If you please put down the slide. Thank you again. Yes. So thank you very much for sharing that. I'm going to go back to the platform. I'm sure there will be questions on that, but I have a question that has been before from Haman in London. He's in London. He said, thanks for the presentation. That is most interesting. He's interested in epigenetics, on how people are affected differently in similar environments. So I guess with the data that you are generating already and that you will continue to generate, I think you'll be able to do that. Do you want to say something?
Yes.
Okay.
Yes, Dr. O. One of my joy in life is for us to be able to correlate with, to work with researchers. Believe it or not, we are talking to NIH as we speak, a National Science Foundation here in the US. We are asking for funding because they do stuff outside the United States, for them to be able to give us some money for us to do some quality research. Be in prayer with us so that we are favored and we get some of this money. We would love to see this epigenetics data, and which will help us in so many ways. It will help us the medication management, the type of medication we use. It will help us to manage our environment better. It will help us to manage our health better. So that is that. Europe, we have our eyes on Europe. I'm going to be going to London May 4th. Dr. Walker is in London, so we'll be talking. Yes, Europe, you'll be able to have opportunity to buy this plan. And we'll be working with Food Soldier on the ground. If I can meet with you when I get to London, I'd love to, if you can give your information, Dr. O, we'd love to meet with you in London and work some. We need agents. We need people that will help us, the evangelists that will help us push this in the diaspora, because it is enough of 42-year-old dying, enough of 35-year-old, 27-year-old dying, just for nothing that can be prevented. I yield the floor back, Dr. O.
Thank you. Thank you so much. Yes, Haman is very proactive, and I have his information. I'll link you up. He said in the UK, there is still a high prevalence of PSA blood tests being recommended for males for prostate cancer. And you know, Haman, that has changed for us in the US. The standard is that we don't test routinely anymore, and it is because of the anxieties that it provokes and unnecessary surgeries and unnecessary interventions that end up to be nothing. So we don't do that routinely anymore. Interesting to hear how the test has been viewed in the US, he said. There has been some questioning of it in the UK, but cancer rates are high in the UK, one of the worst in Europe, and behind many other countries in the world. So that is, you know, that's sad to know. But hopefully with tests like Dr. Olowe just shared with us, those things can be found that will happen so that preventions can be put into action. You know, even if it's just frequent testing like he has shared, so that, you know, the cancer can be caught on time if somebody has the predisposition to it. And he asked if you can please give the details of the app. If you can post the details of the app.
Yeah, it's Dr. Connect.
So if you can post it in the platform, that
let
way.
me see if I can get the links to the app.
Okay. The reason I was saying that wait on the insurance is because I've seen that there's a question, do you have a family package and what is the pricing too?
So
I think it's something. Okay, go ahead.
No, I'm sorry. Go ahead. I'm so sorry.
No. The family package. Somebody asked the question, do you have a family package and what is the pricing for it?
Well, so what we do right now, Dr. O, is we are trying to drive adoption. So we have an individual plan, and the idea and the discussion came up when we're putting this together. The idea is if you have a family of 5, we will be able to bundle everybody together and give a plan. But if we see a lot of demand for family plans, then we'll be able to come down and do something. But for the diaspora plan, we know that most people want to travel with their family. The diaspora plan will come with individual plan and a family plan. But for Nigeria right now, we only have an individual plan, and we have one for 25, for 35. And then when I met with Dr. O and Dr. Izugu, they are talking about creating one more plan that we have a little bit more of testing and things like that. And we're creating another plan for $55, not per month, but per year, that you'll be able to do some other stuff on it. So that is my submission. I yield the floor back to Dr. O.
Thank you. Are you on Apple Store?
I'm going to put the link right now on Apple Store there.
Okay, thank you. So for the family plan to go further, Dr. Olowe actually put a phone number on there, 915-478-8807. 915-478-8807 for you to call. And another question, is there any chance of getting a copy of the slides, please, on the first plan? It will be on YouTube, Hammond. You can get that on YouTube, because remember, I was having difficulty getting the slides. Dr. Olowe, can you get the slides?
Yeah, let me talk to my partners in Nigeria. Since the plan is still in formative stages, it's done, it's live. You can buy it tomorrow if you want. But yeah, we'll be able to get some of the slides to you. But we just want to ask that you please respect. We don't want Nigeria. We copy stuff for nothing, and we end up making a mess of it. So we're trying as much as possible. We don't want people to just keep jumping all over. It's taking us 3 years to put this work together. That for somebody to just come in and say they think that there's a lot of copycat. So we will try and work with you, but please respect that.
Okay, so the question that is there any chance of this being brought to the wider diaspora in Europe has been answered, and Hammond, Dr. Olowe actually has requested that you two contact each other, or you be put in contact, because they're coming to Europe. And Dr. Owoka is already in London, and you will connect so that you can take advantage of this also. This is amazing. It's forward going. It's new gen, and they're thanking you for the answers. Thank you for that link, Dr. Olowe, that you put on the in the chat box. So, are there any more questions? This is new, innovative, and just cutting edge.
So I put a link at the beginning. If you want to copy it, or I can repost it again, that will show you what the devices we use to track blood pressure, blood sugar, and all of that. And somebody can take the blood pressure in Nigeria, and we can see it in real time on the EHR at the back end anywhere in the world. So those are one of the things that we believe that will be necessary. People can take their blood pressure, and you can see that if you are their sponsors in the US. So thank you.
If you are their sponsors and they have given you the rights, the rights
with a signed
signed consent to have access. So Dr. Pokuola, kindly unmute. You have your hand raised.
That is my boss. That is my boss and my lecturer in school.
You are still muted. You are still muted.
Sincerely speaking, like I put in at another site, every time I see this, I get highly elated. I'm so satisfied. And Dr. Olowe, this has come to a point that we have to tell you is classic. It's having a package for Nigeria, which has never been done. And sincerely speaking, my only question is that I have a physician in Nigeria who takes care of my family, including me when I go to Nigeria. Do I have to get him onto this plan before I can take advantage of it while in Nigeria?
They're working on it. It's something we have proposed. I think you're muted, Dr. Olowe.
Okay.
Yeah.
So one of the things that we discussed at our production meeting today is we have the capacity right now that we can onboard an hospital on the platform. that wants to come in, we can onboard doctors on the platform. But in the meantime, if you want your doctor to see you, they can register on our platform. We'll do all the vetting. We check the MDC in Nigeria, check all their credentials, do the interview, and we onboard them. And then you'll be able to see your doctor in Nigeria on the platform.
Is your question answered?
My question is answered with a proviso that I know to be developed upon.
Thank you.
Thank you,
So,
Doctor.
thank you. Dr. Owoka's number in London is posted. Haman, please pay attention to that, and all our Londoners on the platform tonight. Dr. Owoka's number is in the chat box, so you can reach out to him. This is fantastic for the UK Connect. Do we have any other questions?
Mine will be a comment now.
Go ahead.
Dr. Olowe and your colleagues, well, I can't say thank you enough. However, did you do a pilot study with any of these respective groups that you can share with us so that we can see a couple of other things that we might put in? Is there an age limit to those people who can be on your insurance? My father just died at 98 years, and I wish your insurance package was available. It would have saved me a lot of money. What's the ceiling and what is the floor on this project? Yeah.
So if I understand correctly, the age limit for the insurance, we have this insurance we design for a younger folks, for younger generation. But believe me, we have packages for seniors. Anybody that is interested in the senior package, this plan were created for Nigeria for mass market, but we have other plans that are available. We have bouquet of plans that you can buy for anybody at any age. But we just wanted to make sure that we have a plan that you can actually close your eyes and pay $25 and gift to people at any given time. So yes, we have insurance for seniors and they're available, and we'll be glad to engage myself. And then Dr. Mustafa, you can put your number there in Nigeria. If people are in Nigeria that wants to talk to you or they want to reach out to you. So Dr. Mustafa, please put your number there too. Thank you. Dr. Pokuola, did I answer that question?
You've answered all my questions on the forum.
Thank you, sir.
You're welcome, please. Yeah.
Thank you. Thank you so much. Dr. Izugu, kindly unmute.
Yeah, thanks again. Question about insurance. Let's say for companies that want to provide health insurance to their employees, in terms of extending that insurance coverage from the staff to the family members. Have you guys thought about that? And also another question is, because some of the experience we had also in Nigeria was trying to, have a lump sum money for insurance coverage for people. And it was like $50 and stuff. And we realized that by the time the Nigerian economy and the money is fluctuating and buying things and paying, you find that was not enough to cover them for the things you had wanted to cover them for through the year. So what are your plans and what are your on these situations? You're muted.
Thank you, Dr. Izugu. That is a struggle we face every day. But when you want to do business in Nigeria, you have to be willing to go through a lot of phases. And one of our meetings yesterday, that was the preparing for today. That was one. Dr. Kazim just put his number there. So please, that was one thing that we kept on talking about. But be rest assured, if we set the price at $25 and you pay and whatever exchange rate happens, your family will be taken care of to the fullest. And then that will give us an opportunity to come back to come back and do maybe a price hike or a price downgrade or whatever. But we are cognizant of the fact that there will be exchange rate problem. But the beauty about insurance, Dr. Izugu, is we have this 80-20 rule. Not everybody that buys insurance that will use it. So there's opportunity for us to be able to take care of a lot of people. We don't want to lose money, but in an environment in Nigeria that is very unstable, stable and volatile, those are one of the things that keeps us up at night and keeps us on our toes. But my partners in Nigeria have done an amazing job in trying to mitigate this. They've been able to weather all kind of stuff, and they've been at this game since 2005. And I think they are one of the most steady insurance with a lot of clients on their enrollees. I hope I answered that question, Dr. Zulu.
No, you did. What about the company issues where like you have a staff, you want to provide insurance to them, but they have family?
That we like I said, we have other plans. We created this Agbero plan so that we can cover our people in Nigeria, 25 and 35. If you want to see a full bouquet of plan, get with me, get with Dr. Mustafa or Dr. Woka or Dr. Laiwola on the call. If Dr. Laiwola is still there, please put your number. We will be able to give you all the bouquet of plan. We have insurance for offices. We have insurance for employees and their family. What is driving us, Dr. Ezugu, is the passion that we do not want to see people just drop dead. And that's the reason why we are creating this mass market. Is it very profitable? No. But are we banking on volume? Yes. So we want to make it affordable so that people can cover their family member in Nigeria. Please, let's take this advantage and help Nigeria so that we can stop crying for nothing and crying a cry that I'll pray when easily we can solve the problem. Dr. O, I would say a single story, and I will give the floor back to you. I was studying my Bible yesterday morning or this morning, and in 2 Kings chapter 6, the axe head fell into the water. And the man of God asked the guy that was cutting the tree and said, "Where is the axe?" And the guy showed the man of God where the axe fell. You know, to my utmost surprise, the prophet Elijah did not say, "Oh God, where is this axe? Oh God, where is this thing?" He just went and cut a tree and threw that tree in the water, and the axe head floated. That's a miracle, but I believe that is strategy. And I asked God, what does that mean? A lot of times, we don't need prayer, we need strategy. And one of the strategies we need to employ in Nigeria is to have our family member covered, and we have the rest of mind here, and nobody will be calling you every day to send money for medication. I yield the floor. Thank you.
Thank you. So basically what you're saying is, as Paul said, show me your faith without works, and I'll show you my works with faith.
Mm.
So it works together. That's basically what you said, and you're right on the money.
Can I ask one more question? I'm sorry about that. Sorry.
No, before you ask the question, I need to, because this goes along with what you just said. Sister Loretta Mudunku said to Dr. Olowe that that's the beauty of a group plan. Well said. So she's applauding you for your response. So, Dr. Ezugu,
thank you, Ms. Loretta. I appreciate it.
Yeah, that's very beautiful. Some of the experience we also had in Nigeria when you buy insurance and give to people is that they receive it either by rifling or however you give it even to support them, and they don't use it because they don't think they are sick. And a whole year will go through, and then it had to be another round. And so we actually instituted what we call doing good with discipline. Where really, if you had it for a year and you never saw the doctor for preventive care, you can't even participate in the next rifling. So what again, because to emphasize the concept of prevention, where if you actually can go for prevention, if you end up in the hospital, maybe instead of you paying 10% of the hospital admission, you should not maybe pay 0 because you went to preventive cares. so that how we can, what we can have in place to really drive people to understand the concept of let me go see doctors and don't wait till things get so bad and end up in the hospital.
So we need to do lots of education. And it also goes to show what Dr. Olowe said, that some people, maybe most people, will not use the insurance. And, that, helps out when there's a lot of cost that needs to be incurred on somebody. Look, this is conversation that it's too big. It will be too long for us to have, because there are ways to mitigate this. So depending.
Can I make a comment?
Yes, go ahead.
So, number one, Dr. Izugu, the insurance that we have in Nigeria there's only a 30-day waiting period.
Good.
So that it makes it easier. You don't have to wait 90 days, 30 days waiting period, you go ahead. And my partners on the platform, we tell you this. We talked and talked and talked and talked. The number one thing on my agenda for insurance is wellness. And as little as that $25 is, we have some wellness package in there. So when you buy this insurance for your family member, they will be assigned to an hospital. And just like Dr. Izugu said, there are mandatory wellness screening that you must do for you to be able to participate again. If you don't do those little things, then you might not be able to participate the following year. But
for free. They should participate if they pay.
It's free. And one of the things we do is that we will call you. If whatever wellness that you're covered for, there will be a reminder for you to get it done within 60 days when you get on the plan. So those are some of the things we are changing in the insurance company. When I said people will not use insurance, not for wellness. We want everybody to use their insurance for wellness. But not everybody will be hospitalized, and not everybody will need medication. That's what I meant. And that's the beauty about insurance. But the preventive wellness side of the coverage, we don't joke with. I yield the floor.
Excellent.
So thank you so much. That is important, because I bought insurance, the federal insurance for a family member, and that was in December 2023, and they still can't use it. They're still saying we are waiting. It's so frustrating. They didn't even feed back. I'm the one now still, going back and saying, hey, and my family member is asking, when can I see the doctor? See the opposite. They want to see the doctor. So I can't wait to purchase this insurance. They would have only 30 days wait time, and they can get they can get themselves checked. So I'm going to purchase this insurance, Anikulapo Insurance, so that my family members can be taken care of, and in record time. Because when it's beyond 30 days, sometimes people get tired, and they don't follow up anymore. This one is asking, wants to be cared for. Insurance has been paid for, but we can utilize it. So Sister Loretta said, getting the people to comply might be challenging without people back home. How do you plan to deal with that? Education, 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 sister. And I'm telling you about this family member who is on my case, that let me see the doctor. You paid for the insurance. Why are they contacting me? Where do I see the doctor and all of that? So some of them actually with education have been able, and it took education for him to get there, because we go home to do medical missions, and part of our medical missions is, educating. A big part of it is education, educating, and they got it. So we have to continue that. But there's a question here, Dr. Olowe, from Dr. Pokwola. He said, any medical missions working with you, how will this insurance package benefit medical missions?
So let me answer the question of Ms. Loretta. The good thing about it is that as a beneficiary, as the sponsor of the insurance company, if they have them signed a consent, you will get a feedback, and you have access to look at the EHR, the portal, number one. Number two, we have a check-in with them, and the wellness that they will be covered for they must do that wellness within 60 days when they get the plan. And if they don't do that wellness, then you have the right to cut them off. Because if they are waiting for them to be sick so that they can go to the hospital, you don't have time for that. And so if you are paying for somebody, it's free, and their doctor is not in Timbuktu, if the doctor will be in their environment that they can go in. And like I told you, the entire test that I show you, the entire data that I show you, we can get those tests done in 45 minutes. But for this lower plan of $25, if you walk into our office or walk into any of our hospitals that we're affiliated with, you can get out in 10 to 20 minutes for the baseline wellness. On the medical mission, in fact, we'll love to do a city tour in America. Once this is fully launched, we'll come to Baltimore, Dallas, Houston, and push this. If we have people around all over the United States that we can talk to and we can do a roadshow, we're glad to do that. Medical mission, we are game. Because the purpose of a medical mission is when you see these people, you intervene, you do what you need to do for them. The best bet is to buy the insurance for them to be able to continue to get better. Because it would be futile to do all this medical mission, fly to Nigeria, you give them 30 days supply of medication, they finish that, and that is over. The best use of money would be, say, hey, we've done 10,000 people, here is $25 each, scholarship here to get them on insurance, and we are ready. We'll be glad to work with any mission. We have offices in 28 states in Nigeria, and we're willing to expand to the entire 36 states. I yield the floor, Dr. O.
Thank you. So I want to go back to Sister Loretta's question. It's very important. The question is, getting the people to comply might be challenging with our people back home. How do you plan to deal with that? We know the plan. We know what you do. They have to access in 60 days. But how do you get people to comply? Again, it's going to take education. And there's a danger in the fact that a lot of us in the diaspora are willing to purchase this insurance. We know it makes sense, because if we wait till people are sick when they call us, we know how much we dish out to do that. So having preventive care, catching these things on time, and actually, preventing or treating on time is very important. But when they didn't pay for it and we pay for it, that may be a problem also, because the money didn't come out of their pocket. They may not be compliant. So we also that are paying for this plan need to, I don't know if we have to blackmail them, whatever we need to do, we need to get them to utilize the insurance within that 60 days. So a lot of it also will depend on us helping out to make sure that they are compliant. It's going to take all of us to do that. So Sister Umi comes in from California. That's my sis from California, as a hand raised. Can you unmute, please?
I'm driving, so hopefully you guys can hear me.
We can hear you. We can hear you.
Okay. Thank you, Dr. O, as usual, my dear sister. And thank you to all the presenters. Sorry, I don't have the names because I've been kind of multitasking, but listening in. So my question is, how do you handle people with pre-existing conditions?
Good question. Excellent question.
On our insurance?
Yeah.
On your insurance, yes. For people in Nigeria.
Yeah.
Pre-existing conditions.
So like we said, there is a waiting period of
30
X
days.
number of waiting days, 30 days. And then we have a cap on the insurance, but there's no exclusion. We take all of you. If you meet your cap of utilization, then you have to wait till the following year, or you might need to get a rider to cover your insurance, to cover yourself. But I will let Dr. Walker or Dr. Mustafa answer that question because they are more experienced than myself. Dr. Mustafa or Dr. Walker, how do we handle people with pre-existing condition?
Thank you very much, ladies and gentlemen. Am I audible? Thank you very much, ladies and gentlemen.
Yes, you are.
is during onboarding, we appreciate full disclosure. So if an intending enrollee discloses all the ailments, we may even get across to the enrollee to discuss all these pre-existing conditions. And if there is any need to move such enrollee to a higher plan that he or she will fully benefit from, we advise from inception. But I can tell you, the reason why we are looking at a mass market is to be able to have enough volume to absorb most of the complicated medical needs. But we have a system that can interact effectively with an intending person, especially if the person fully discloses and fill all the parameters correctly.
Thank you so much. And
Thank you so much.
Thank you for
thank you. I appreciate it. I have an additional question based on prior comments from Dr. O. So we talked about urging or motivating the people in Nigeria to go do the pre-screenings and all that stuff. Are we, the sponsors, going to be involved in the information? Because how do we, I mean, I don't know if I'm asking the question correctly. So let's say we sponsor. So I'm planning to buy a plan like Dr. O mentioned too. I'm planning to do one. Am I going to be involved in the communication with the patients in Nigeria? Are we included, or for privacy reasons, we're not going to be included?
That Dr. Olowe actually addressed that. If the person you sponsor gives you written permission to them, signed consent that they want you involved in their health, then you would have full access to the electronic health records information. This is different. There's nowhere in Nigeria that I've seen this where patients actually have access to their records. We have it here. We have the patient portal. The electronic health records they use also have the patient portal. So they have access. So if they give you access, signed access, consent, then you too would have access. And you can follow along in their health. But they have to give that consent.
Okay, perfect.
Am I right, Dr. Olowe?
Yes, 155%, Dr. O. And I'm glad you've seen the EHR.
Yes.
Dr. O has seen the EHR, so it's very robust. You can get record in 1 to 5 minutes.
Yeah, that's true.
Okay. Thank you so much. I truly appreciate the responses. Yeah, so I'm excited too.
Thank you, but I want you to concentrate on the road.
Oh no, I'm home now.
Oh, you're home.
I'm
Fantastic.
home now. Yeah, that's why you can see me on video. I won't be doing this while I'm driving. You guys should mark me if I do that.
We don't want to buy insurance for that.
Yes.
I know, right? No texting and driving or video and driving. Thank you so much. I appreciate it. Thank you.
On that note, before I go on, somebody
Dr.
texted me. Wait, just 1 second, please. Somebody texted me. They are giving $150 to 6 people for insurance, people of your choice who need it. And they also asked, how much is it for seniors? Because this person is thinking of the, general young population that you talked about. And they want to know how much it is for seniors. They're donating this to 6 people for insurance.
Just like Dr. Mustafa said, and I will give him the floor to answer that question. But before I move on, somebody asked a question about what about pediatric people?
No, we're not there yet.
Okay.
Yield the chat box to me. There are questions before that.
Okay, fantastic.
Otherwise, we will not get everybody answered. And we just want you to focus on.
I'm sorry. I'm just trying to kind of respond when people are. So let me give Dr. Mustafa that. I'm sure we have a plan, not expensive for senior people. Dr. Mustafa, can you take that question for senior people?
Yes. Yes.
Can we please take a moment to just thank this person? We appreciate her for the $150.
Oh, thank you. Thank you
so much. Thank you so much.
Thank you. Okay.
Okay, back to the question, Dr. Hope. We have geriatric plan. Incidentally, this is our first encounter with you, but through Dr.
Okay, sorry. Go ahead. Go ahead. Sorry, Dr.
Okay.
Mustafa. Go ahead.
Yeah, we have the senior citizens plan, and that will be shared by Dr. Olowe, to you guys. Today's meeting is just like let's get to meet you, and we are really very excited for the feedback. So we have the plan, and it will be shared appropriately through Dr. Olowe.
Okay, that's fair enough. Thank you. So, Dr. Olowe, can you share with us some of the hospitals you are affiliated with? It's a question on the platform.
Okay. Number one, I will let Dr. Mustafa handle that, but we will have all the slides for presentation to Dr. O, and Dr. O can send it out as much as to whoever she wants to send it to. So Dr. Mustafa, some of our hospitals on our platform, can you go over them, sir?
Okay, thank you. What we have done is to accredit hospitals from all the 36 states in Nigeria, and then that can also be shared. As part of what we're sharing with Dr. Hope, you can also share that with her later. Okay. But it's quite a volume. Each state, whether it's Adamawa from A to Z to Zamfara. So we have accredited hospitals in the nook and crannies of every part of Nigeria. That will be shared with you, Dr. Hope.
Okay, thank you so much. And as far as I know, it's still growing. The list is still growing.
Yeah,
I think I've seen over close to 1,500 hospitals on the list. So it will be a very robust hospital plan. And for the people that are coming to Nigeria that will be buying higher plans, we'll develop partnership with Eurocare, Evercare Hospital, so that when you come home, you can get the best of hand to take if you do need it.
Fantastic. So Auntie Tower from Florida, Tampa, Florida, says, what about PD patients? Do they pay the same amount? Pediatric patients, do they pay the same?
Dr. Mustafa will take that.
Because you talked about family plan. Okay, Dr. Mustafa, what about pediatric patients? Do they pay the same? Dr. Mustafa, kindly unmute.
Sometimes that is
Okay. Yes, that is the essence of the family plan we're going to come up with in the later time. But right now, everybody can buy the private plan. Like I said, during onboarding, the information will make us to do further communication and contact with the will-be enrollees. But obviously, we cannot leave our children out of a very good innovation like this.
Thank you. So, Sister Tinuade asked, sliding scale fees assessed to them will force them to comply. Oh, about compliance. So she's saying that sliding scale fees should be assessed to them. I'm going to get with her. Sister Tinuade, do you want to explain what that means, in what form? Can you unmute and let us know?
Yes, ma'am.
Yes, please. Explain to me. That's our attorney in the house. And let me tell you about this attorney, because when you hear lawyers, you just hear lawyers. This is an attorney who actually works to bridge disparities between, disparity and gaps in women and children. She does a lot with her organization, She Rises, to just do so much for women and girls. They're traveling to Uganda very soon, and I'm going to be asking you on Medical Mondays to please donate to their trip. Once I get the flyer, please assist. They do a lot. She's not just a lawyer. She has a heart, and they're doing this in medicine, basically. You know, she's a lawyer, she's a doctor. She just doesn't know it. So go ahead. You have the floor.
Doctor, you're my doctor, my part of the doctor. Thank you, Sma, for the warm and kind introduction. Yeah, thank you, doctors. Dr.
Olowe.
The one, and Owoka, all of you. Thank you for the championing this course. I have one. I will explain what I meant by sliding scale fee. I know that when I was at Family Crisis Center, and we used to assist victims, you know, of domestic violence, and what they actually require them to do, they don't charge them, you know, but when you come in, the sliding scale fee is just a token. It could be, in your case, it could be 10 naira, it could be 100 naira, it could be 1,000 naira, just so something comes out of their pocket as a commitment, aside from what $25 or anyone in the diaspora may have paid on their behalf. Maybe that will engender them to, you know, comply, or actually, because, you know, if you nothing costs you, then you tend to like be negligent with it. So that's where that's coming from. So if that makes sense. Yeah.
It makes sense to me.
Okay.
I
Okay.
think this is something you all need to consider, because that was the point I made earlier.
Mm-hmm.
People
Yeah.
who have anything contributed, they usually don't appreciate it.
Exactly.
We would love to talk to Dr. Tunade and get more.
I'm not a doctor.
She's a lawyer. She's an attorney.
Yeah.
Okay, sir.
Our wonderful colleague.
Attorney. She's an attorney.
Yes.
I'm a lawyer. I'm not a doctor. But
we would love to get more information about that, and we'll be able to we need all the intelligence we can get, because this is number one priority for us. Nigeria will be saved.
Mm-hmm.
Yes.
Yeah.
And I can't really be proud of you more, you know, for championing this. And Dr. O and some people on this platform, they know that I lost my older sister 2 years ago to colon cancer, which was so rapid within 3-4 months, and she was done, you know. So, but ever since then, I've been, in fact, I think I spoke with Dr. Izugu, you know, regarding helping women and, you know, younger women from 35 to perhaps 55 or 60, you know, to test early so that they can detect. And then when they detect whatever, they can as well swing in quick, you know, to do the treatment plan. But it's never got off the ground. But when I heard you talking, I came in late, but I don't know if this plan of yours will be geared towards that, and how, if not, how you can weave it into it. Thank you.
Thank you. That's colonoscopy, colon cancer.
Yes. Well, like I said, we would love if you can share Dr. Ms. Tunuade's number with us. We would love to talk to her. Yeah, like I said, our platform is evolving. We have plans, and we have plans. The plan we showed you, if you look at our website in the US, I showed it. You will see all kind of tests, like lung function tests, PVD tests, and all that can be done. So yes, we have an a la carte that you can pick. You can pick your whatever you want on the plan, and we can test it. It's just going to cost a little more from the basic plan. So it is available. It is going on in Nigeria as we speak. Thank you.
Thank you so
much.
Thank you. Thank you so much, my darling attorney, Tinu. And Sister Loretta says she imagines full security measures have been put in place to protect people's information. Dr. Olowe.
I referenced that earlier. We are HIPAA compliant, though we're in Nigeria. Like I said, I've practiced here for 30 years. before I hung it up this 2023. We are HIPAA compliant, though we are not required to in Nigeria. We are GDPR compliant, NDCDC compliant. We are hosted on Azure, Microsoft Azure, and we are working on we're working on what is called data vaulting, which means HIPAA, Azure, all those measures, and then you put it in a vault as well. So security is paramount to us. And like I said earlier, Dr. Aluya said, the best of the best get hacked. Yes, I agree, but up till now, by His grace, we've never been hacked. We've never lost anybody's information or anybody's data, and we hope to continue that way. So security-wise, we are solid. And all the people that work with us, we have engineers that work with us. We have data scientists that work with us. I hope I answered that question, Ms. Loretta.
And by God's grace, you will not be hacked. So,
amen.
Haman said, well done to who has given the generous offering, paying for 6 individuals. Yes, thank you. A person who has done that, she's amazing, but she never likes a name in the open. So I've got to respect that. She's amazing. You know, Mr. Lawal, VP at NAPAC National, said, it is not enough to be in every state or every town, but also in every neighborhood, so that the participants will have easy access to the providers. That means you may need to have wide pool of doctors, not just in public hospitals, but also in private practices as well. This is a very commendable venture, and thank you for the presentation.
We are doing our best. We are currently raising funds. So it takes a lot of money. My 401k has gone into this. So we are expanding as quickly as possible. We want to get into every neighborhood, every state, but it takes finances. It takes a lot of money. You know, the first 2 years in Nigeria, our face saw wahala. Nobody was looking at preventive care. Nobody cares. Nobody wants to know. In the name of Jesus, not gonna happen. But we thank God that things are changing right now, because we decided not to quit. So we will get to all these corners as soon as possible by His grace. As we get funding, we'll be able to do a lot of that. Thank you.
I want to say kudos for what you have done, and people like me navigating Nigeria, knowing what it takes. This is incredibly amazing. I say thank you to all of you who has done this. Thank you so much. It's amazing. It's incredible. And, you know, suggestion, you know, I don't think you should put finances into those neighborhoods and all. I think allowing the clinics, the private practices to participate in the insurance program would now cause that to be in those neighborhoods. You know,
and that is the strategy, but it takes money to get our infrastructures into those practices or into those neighborhoods. We cannot be everywhere, but we can have partners everywhere. But the way we operate, they have to be able to comply so that we can have the same standard. If you do it in Ibadan or Lagos or Akure, we have one standard, and that's how we're able to monitor quality and progress.
And that's why you stand out. I get it. Thank you.
Thank you.
Sister Wumi, kindly unmute as Sister Wumi comes in.
Hi. I'm not able to access the prior chats that or whatever went into the chat room. I don't know why, maybe because I'm on my phone. So is it possible to post the information, like the contact info, to get the insurance, please?
Okay, I'm going to start.
It's not showing it to me. I don't know why. It's
all right. So if you look in the chat box now, everything that has been posted, I'm going to try repost.
Okay, got it. Okay, all right. Thank you.
Olowe, that one that I posted, what is it for?
That is the link to the app. The app you download to access our product.
And if we want to sign up, would that information be there as well, or do we contact a specific person?
For the insurance, like I said, this we've had some meeting with Dr. O. So if you want to just contact me, we will guide you. The website and all of that will be rolled out in the next couple. We just wanted to kind of sensitize this. And that, but if you want to buy the plan today, it's available. We just have to guide you and direct you to how to do it. But you will be in the next one month or so. All of this will be available on the website. We'll be able to buy directly and all of that. But if you need anything, contact us. We will get it to you right away.
Okay,
The plan is live anyway. So
great, thank you.
So thank you so much. I have a question. Sister Umi, I keep posting. Look at all the things I'm posting.
Yeah, I'm seeing them now. Thank you so much, Dr. O. I appreciate it.
Thank you. So,
and thank you again to everybody that presented. I don't have names, but I do truly, truly appreciate all your efforts. Thank you, thank you, thank you.
Thank you.
Thank you so much. We appreciate it.
There's a question here. Can you please specify the age group covered in your basic plan? Are the tests gender specific also? So 2 questions. The age group in the basic plan, and is it gender specific?
We want to test as early as possible. We work with companies in Lagos, and we've tested as little as 25-year-old to 50, 60 years of age. Gender specific, yes. If you want, like Ms. Tinuade was asking, if we can do mammogram for you. It's not on the basic plan because we build those plans just to make sure that everybody can have a foot in the door. And then if you want to add mammogram, PSA, cervical screening and all of that are available, and we just have to give you the cost of that on top of that. So that is where that is the answer to that question. Yes, gender. If you want to do PSA as part of your stuff, we will go ahead and do that for you. So you can even build your own plan. You can say, hey, I want colonoscopy, I want this, I want that, I want that. We will try and get it to you through our partner. We don't do everything, but we can get you to the right and the best hand to do it. I hope I answered that question.
I think you did. So, Attorney Tinuade says, thank you so much for staying through the ups and downs of Nigeria. May God bless you all mightily. Thank you.
Amen.
I concur. So, any other questions? So if there are no other questions, I just want to thank NALA again, the Nigerian American Lawyers Association, and especially Attorney Richard Aganga Williams, who is he was the past president, because now they have a new president starting Friday, and he handpicked me for the Presidential Award given by NALA, the Nigerian American Lawyers Association, on Friday. It's very, very humbling. I am appreciative from the depths of my heart, and I wanted to share with the Medical Mondays family. And I want to thank those who were able to attend from the Medical Mondays family. Thank you for coming, and thank you so much, Attorney Richard Aganga and the NALA family. I appreciate you all. So, Dr. Olowe.
Good evening.
Good evening.
This is the Akinloye Olowe.
Yes, Dr. Olowe, welcome.
Yes, how are you? Yes, I've been on the platform. Thank you, Dr. Olowe, and your team. This is part of the movement. This is a movement, as far as I know. It's not, it's coming, and the platform is being built. So I will encourage everyone to spread the news. It's very necessary. When something is starting newly, it takes a lot of work and a lot of effort. And Doctors Connect has started hitting the ground running now. So we pray that the society will be fully receptive 100% and take advantage of what is brought to them. Yet, thank you, Dr. Olowe, and your team. And Dr. O, thank you for your platform as usual. So you propagate the news. Thank you.
Thank you so much. Thank you, sir. I appreciate you. Thank you.
Thank you, Dr. Olowe.
Yeah.
So, Dr. Olowe, kindly give us your parting words before we leave the platform.
Thank you so much, Dr. O.
Your parting advice.
Yes. One of the things that I covet is longevity of life. And I believe God has given us the power to determine when you live. One of the gifts that God gives to all is God gave to us is free will. And I pray that today you will take the advantage of the technology and what God has given to us for us to extend our lives and make sure we know what is going on. It is okay to be sick, but not to know that you are sick is the problem. Because you can see we have a brilliant mind that can take care of you. So there's a power that God has given to us for us to be able to live long as we want. But the power can only be activated when we take good measures. You can carry debt in your pocket, which is why we chose Anikulapo Insurance. You can actually carry debt in your pocket. And when you carry the debt in your pocket, you know where debt is at any given time. May we live long. May God bless Nigeria and may God bless the United States. Thank you. You are muted. You are muted, Doctor.
I said, thank you. Thank you so much. Thank you for letting me know also that I'm muted. I didn't realize it. I appreciate you. And thank you, everyone, again. Until we meet next week, please be safe. Thank you.
Good night. Good night, everyone.